Good afternoon, everybody, and welcome to the Milken Institute School of Public Health. Whether you're here in person or joining us online, we welcome you here. My name is Lynn Goldman, and I am Dean of the Milken Institute School of Public Health, and delighted that you can be here with us today, whether here or online, to take part in this very important discussion. I wish to thank first the American Public Health Association, the Children's Environmental Health Network, the Environmental Defense Fund, and the National Center for Healthy Housing for partnering with us. I have to say that in each of those cases, I've had very long and very deep relationships with those organizations, and so it's particularly a thrill for me to see you all coming together here. There's no doubt in my mind that lead in our environment, including soil, dust, food, and in particular drinking water, continues to be an ongoing problem. For those who don't know me very well, I've been involved with lead poisoning, and particularly prevention of lead poisoning for children throughout my entire career. First working for the state of California, where I founded the Childhood Lead Poisoning Prevention Program there during a time when people on the West Coast thought they had no lead on the West Coast. Then while I was at the EPA, when I was responsible for the rulemaking around the 1992 amendments to the Toxic Substances Control Act, where Congress had specifically directed EPA to write certain rules relevant to the cleanup of lead in housing and guidelines. And then later, as a scientist, when I was a professor at Hopkins, studying the effects of lead in newborns vis-a-vis birth outcomes, and also the blood pressure and health status of pregnant women. In my career, I have seen remarkable transformations in this field. I served on the CDC's Childhood Lead Poisoning Advisory Committee back in 1990, if you can believe that, when we decided to lower what was then considered to be a toxic or dangerous level of lead from 25 to 10, and the controversies around that. And of course, that level was lowered another time, and in my opinion needs to be lowered once again, because what we've seen over time is that as we have been successful in lowering average blood leads in the population and the numbers of children above certain levels, we also then have revealed to us the adverse effects at the lower levels that were masked at a time when we had so much more exposure. As another piece of context, when I was first working for the State Health Department, and I took responsibility for a lab that monitored lead poisoning in children in California. When I first came on board and did my tour of the lab, they said, why don't we look at your level? You can be a control for us, And at that point, having finished medical school at a prestigious university, University of California, San Francisco, having finished a residency in pediatrics, my blood lead was 14, which today would be appallingly high if we saw that probably in anybody in this room. But at that time, when there was still lead in the air from gasoline, still a lot more lead in food and drinking water, and many of the sources that have been controlled since that time, that was not even considered to be an abnormal level. That's before the normal level was lowered, from 25 to 15, and eventually to 10. And so, the context is very interesting. An entire generation of children grew up at a time when what we consider to be acceptable were far higher levels than are today. But the other thing we used to think was acceptable, and certainly I was guilty of this myself. It was true at the EPA, it was true at the State Health Department, it was true across the country, which is that we used to feel it was acceptable to manage lead in place. And unfortunately, the rulemaking that was done in the 1980s by EPA's Drinking Water Office, the so-called lead and copper rule, very old rule. The rulemakings that were done, the guidance that was done around abatement of lead in housing, presumed that it would be technologically feasible and possible that over many years, lead present, whether in plumbing or in paint or in other sources in the environment around children, could be managed in place. As long as it were managed in place, there wouldn't be exposure. That was the logic. And I think what we have learned is that that is not a public health solution to lead. And I think that what happened in Flint, Michigan was an ample proof of that, that simply managing that lead in place in the pipes meant that it was there when the water chemistry was changed. It was there to be able to leach out of the service connections and into the water that children were drinking, even if it hadn't been doing that in the past. We also learned that lesson well prior to Flint, right here in Washington, D.C. When the chemistry of the water here was changed, it was for a different reason. Homeland Security was worried about massive amounts of chlorine gas being stored in the nation's capital and the potential for terrorism. They had a point. They had a point. But the disinfection of the water was changed such that the chemistry of the water was changed, such that the water became corrosive, and we had the very same problem right here in D.C. as the problem that happened in Flint, Michigan. And, by the way the lead and copper rule was implemented was very similar in terms of when the contamination was identified, it was not disclosed to the public in a timely fashion, action was not taken in a timely fashion, and that every effort was done possible to try to redo the sampling, redo the, so that they had different proportion of the samples above certain levels. And when you read that rule, it is not a very science-based rule. How they do the sampling, it's not a science-based sampling strategy. There's just no way that you can say that. So of course, these issues can be addressed, and as a pediatrician, they must be. I do feel if we had stronger enforcement of the rules that are already in place, we'd be better off. But I also think that there are a couple of other things we have to think about if we're going to avoid these tragedies in the future. And, one is that we need to revise that 1989 lead and copper rule. And I've blogged about this, I've written about this, many of you have. It's very frustrating to see that there's been such a long-term process to do that, and it has not been done. And I'm eager to hear about approaches that can be made to make that happen. I'm very concerned with the current EPA that there may be further delays in seeing progress in this, and that I think that's something we need to be cognizant of. But I think, and I think that we've got to get to the point that we understand, whether we're talking about removal of lead and paint from walls or from pipes, that the very process of doing removal is something that has to be done with great care. And, in medicine, we talk about first do no harm. First you do no harm. We know that there are ways to do this that actually cause levels to spike, whether it's in the water or in the dust or other ways that people might be exposed. So we have to do it correctly. And in the case of drinking water, we may need to replace the supply of drinking water during the time when the lead that's released from taking the lead out of the system is spiking up. So it can't just be done willy-nilly. We understand that it's a technical challenge. We also understand it's important. Frankly, I think we're digging up the streets all the time. We dig up the streets to fix the internet, we dig up the streets to fix the gas line, we dig up the streets to fix the sewer, we dig up the streets to do, fix the streets. And, if we had a plan to replace the lead service connections, why wouldn't we replace those every time we dig up the streets? It's crazy that we don't do that, because a lot of the expense is just digging up the streets. So I think that that's something that some cities have been thinking about, but that to think about this holistically, it's about a whole system of providing services to communities. But the other thing I think we have to think about, and I know it's not the main topic of this, but what about the children who have had those lead exposures? Now, I've already told you, I somehow made it through college and medical school and a pediatric residency with having what today would be considered to be fairly high levels of blood lead, which is to say, we should not stigmatize communities that have had lead in their drinking water and other lead exposures. We need to understand that children are whole people and that there are many factors that have to do with their success in life. And we need to address those factors, and especially for children who have been exposed to lead. We need to make sure that whether it's nutrition or education or the social supports that they need, this is also important. So, in closing, thank you so much for having set this up today. I really look forward to hearing the discussions. Thank you.
Thank you, Dr. Goldman. I'm Amanda Reddy, Executive Director of the National Center for Healthy Housing, and it is my pleasure to be moderating today's event for you. We welcome everybody joining today. We have a full audience here in the room with us today, and I also want to extend a special welcome to those of you who are joining us online. We received over 1,000 registrations for this event, so we know that this issue is still resonating and relevant in communities all across the country. I want to extend a thank you and appreciation and acknowledge the organizations responsible for today's event. That includes the American Public Health Association, the Children's Environmental Health Network, the Environmental Defense Fund, the National Center for Healthy Housing, and of course our hosts, the GW Milken Institute School of Public Health. As members of the Lead Service Line Collaborative, we are so excited to be convening this conversation with all of you here today. And I chose that word conversation very deliberately because meaningful conversation and exchange has really been at the heart of the collaborative's process since day one. And so we're excited to be engaged in a conversation with all of you. We'll give you instructions, especially for those of you online, for how you can be participating with us here in person. And on your screen right now, you'll see some of the ways that you can join the conversation on social and tag the organizations that have been involved. We're really here today because despite decades of progress and an abundance of cost-effective and proven solutions, children all over the country are still being exposed to lead. And that's just the reality. We know that there are about 4 million households with children where lead hazards are still present, and that about 500,000 children between the ages of 1 and 5 have blood lead levels that are above the CDC reference level. And that doesn't even account for older children who may have been previously exposed, or children whose blood lead levels show that they're being exposed, but they haven't reached that threshold yet. It also masks the grim reality that there are persistent disparities and that some communities are more affected by others and bear a disproportionate share of the consequences of lead poisoning. And at this point, the consequences are very, very well characterized. And I'm going to take a moment here. Apologies to those of you who've been at this as long or longer than I have, but we do know we have some students in the room and maybe some folks listening online who are newer to the world of lead poisoning. So we're going to just take a minute and review some of the background and context so that we can all engage in a conversation today. Very high doses of lead poisoning, those that we don't really see in the US today, can cause seizure and coma and even death. But the epidemic of lead poisoning in the US looks quite different than that. Lead exposure frequently occurs with no obvious signs or symptoms. So without proper screening, it can easily go undetected and unrecognized. There's no known safe exposure for children to be exposed to lead. There's no known safe level of lead. But children who are exposed to lead can suffer from neurological damage, memory impairments, attention disorders, hyperactivity, impulsivity, among a host of other consequences. And some of those consequences can happen at even very low levels of exposure and still have lifelong consequences on academic performance and earning capacity. It's important also to note that the financial fallout from lead exposure doesn't just affect the families of children who've been exposed to lead, but also cost our societies billions of dollars in public spending on special education and juvenile justice and other needed and necessary follow-up services. You hear a lot about children when we talk about lead, and sometimes people ask about effects on other parts of the population, and lead can affect people of different ages, but young children and babies are particularly vulnerable to the effects of lead because their brains are still developing. And we don't understand everything about the way that lead affects the developing brain, but one of the ways we know that it affects it is that it can compete with other metals in the body, like calcium, zinc, iron, and copper, that a developing brain needs to build brain cells and connections. So a dose of lead that would have little effect on or no effect on an adult can have a significant and lifelong impact on a child. So the Centers for Disease Control and Prevention recommend that public health actions, and those include things like case management services, environmental investigations to find and remove sources of lead exposure, other follow-up services, that those actions be initiated when a child's blood lead reaches 5 micrograms per deciliter. That's known as the reference level. And for those of you who are newer to this field or just starting to get familiar with the history and the literature, I apologize because we have used different terminology. As Dr. Goldman alluded to, there have been and different action levels over the years as we have new evidence that there are effects at even lower levels of exposure. And to make matters even more confusing, action levels can vary from state to state and from community to community. We may even have some diversity on our panel here in that regard today. So in one community, a child with a blood lead level of 6 micrograms per deciliter may get a full set of follow-up services, where in another community, a child may have to reach 10 or 15 or even 20 micrograms per deciliter before they get that same set of services. They don't always line up with that CDC reference value. Lead exposure, as we've heard earlier today already, comes from different sources, including air and food, water, dust, and soil, to name a few. And for many of us, when we think about lead poisoning, we think about lead-based paint. And that's natural. And lead-based paint is still the most widespread source of exposure for young children. But when we're looking at a specific community or exposures for a specific family, that picture can look quite different. And so that's why it's more important than ever. I cannot strongly enough echo the sentiment of Dr. Goldman that those of us in the public health community, whether you're just joining the public health workforce or like some of us, you've been at it for a while, we really have to start looking at lead exposure more holistically and commit to implementing comprehensive solutions that address a range of hazards in a given community. And I think this message has started to resonate really powerfully in the wake of the water crisis in Flint, Michigan. And many of us in the public health community have started to learn a lot more about what we can do to protect children from lead in drinking water, because this is a problem we can solve. We have cost-effective and proven solutions. A recent report from the Robert Wood Johnson Foundation and the Health Impact Project at the Pew Charitable Trusts estimated that if we replaced leaded drinking water service lines in the homes of all children born in 2018, born this year, we would protect an estimated 350,000 children and generate $2.7 billion in future benefits. Another way of saying that is that we could get a return of $1.33 for every dollar we invested for doing the right thing. So we understand that we have a problem. We have proven and cost-effective solutions. What are the barriers stopping us from eliminating this source of lead exposure once and for all? How can we understand, and more importantly, how can we remove those barriers? And that's really the question that has catalyzed the formation of the Lead Service Line Collaborative. This collaborative is a group of 25 national public health, housing, water utility, environmental, labor, consumer, state, and governmental organizations that have banded together to figure out what else we can do to support communities in voluntarily and proactively replacing their lead service lines. The collaborative has been guided by the principles that replacing lead service lines represents a very significant opportunity to reduce lead exposure in this country, that, as Dr. Goldman pointed out, residents must be protected throughout the entire process, that any replacement initiatives must be implemented so that all consumers, all residents benefit equitably, regardless of race or ethnicity or income, and that we need, and I'll even go out on a limb and say that we have, a wide variety of collaborative and innovative models for how to get this done that suit a wide range of different types and sizes of communities. About a year ago, I think, about January 2017, the collaborative published an online toolkit. You can see it and find it at the Lead Service Line Collaborative link on the screen below, to try and figure out how we could support and to support the communities to voluntarily develop and implement lead service line replacement plans and try and remove the lead service lines connecting an estimated 6 million homes and businesses to community drinking water mains. The toolkit includes a roadmap for how you can get started. It includes strategies for how you can identify a lead service line. For those of you who don't know what a lead service line is, we have a diagram on the screen that shows how it really is the connection between the indoor plumbing of a dwelling or a property, connecting that to the community drinking water main. It's that part in blue on your screen. So how we can identify strategies that will allow communities to identify and remove those leaded service lines in a safe, equitable, and cost-effective manner. Policies that locals can consider to support this process, as well as a wealth of other resources and case studies that communities can find helpful. And I think I also want to mention, based on my own participation in the collaborative, something that I have valued is that a key thread throughout the collaborative's process has been the inclusion of a diverse set of experiences and perspectives. knowing that we need all of these stakeholders to play a role in finding the right solution for a community. And this is reflected even when you go to the homepage of the toolkit and see that all of these stakeholders have a role to play, but may have different entry points and different needs at the beginning of the process. So today's event is really an extension of those resources, and our panel includes a rich array of experiences from communities that have struggled and sometimes failed to protect their residents from lead in drinking water, and thankfully also examples of communities that are taking and have taken proactive steps to prevent lead exposure in drinking water. We're going to open our panel today with remarks from Jacqueline Vargas, a parent from Flint, Michigan, whose daughter was affected by the ongoing water crisis. We're also going to hear from Jean Schultz from the Health Department in Milwaukee. This is a health department that late last year made headlines for some innovative steps they were taking to protect residents from lead in drinking water, and who, it must be acknowledged, also, unfortunately and more tragically, recently has made headlines because of a breakdown in other systems that were in place to screen and protect children. And I will just acknowledge, and Jean will remind you later, that she won't be able to discuss all of the specifics of that case and answer all of the questions you may have today, but I do think the rest of us here can have a serious and frank conversation about what else we need to be doing at the federal, state, and local levels to ensure that our local health departments are adequately resourced and funded to do the job they need to do to protect public health in their communities, and yes, of course, to be able to make sure and ensure that they follow through on that solemn duty to protect their residents. Then we'll hear from Cincinnati and the story in Cincinnati about how the public health department and the water utility have been partnering together to protect residents and public health in that community. And then finally, we'll close with a conversation between the panelists and all of you. And I know that these are challenging problems to solve. Dr. Goldman alluded to that in her opening remarks. They can be difficult challenges to add on top of what so many of you are already doing every day to protect the residents in your community. But if the response to today's event is any indication at all, we also know that there are veritable armies of you that are ready to tackle this problem. And so we hope that the ideas and resources that are shared here today are going to really set the stage for conversation and action in your own communities. And so without further ado, I would like to begin by welcoming Jacqueline Vargas to the podium. Ms. Vargas is a parent, a mother, a student, an employee, a volunteer, and a resident of Flint, Michigan. Following the tragedy in her community, she's come forward to share her own family's experience with lead poisoning. And I really just thank you so much, Jacqueline, for being here today and agreeing to join today's panel and bringing that important perspective.
Thank you, Amanda. Thank you to the American Public Health Association, Environmental Defense Funds, Children's Environmental Health Network, George Washington University for allowing me to share my story. So the beginning is late 2014, 2015. I got pregnant with my daughter. Everything was going smoothly as I thought because I was taking a shower, doing everything normal. As throughout my pregnancy, things started to change. I started getting rashes. They gave me steroids because it's a pregnancy thing. I couldn't drink water, absolutely, like nothing. The only thing I could get down was the Coke. But I went back to my doctor. My doctor said, no, you need to drink water. Water's good for you. You need to drink water. Something's not right with the water. It doesn't feel right. No, it's just pregnancy. It's May 2015. I'm taking a shower, and you come out. Well, I came out, and I felt gel on my body. I could see black dots and so on. This is not what a shower should look like, or anybody in a bath. But it was my pregnancy. I started losing a lot of hair. I'm barely getting it back. Rashes, and they give me, more steroids, and a lot of more things. Throughout my pregnancy, my dad is somebody I have to thank for. If it wasn't for him, I don't know where I would be. We got letters on our home saying the water's okay. There was a Legionnaires' disease thing, it's okay. There was a bacteria, it's okay. Everything is okay completely to the city of Flint. At this time, it was September 2015, my daughter was born. I still didn't know nothing was okay because the parents in City of Flint, everything was fine. 2 weeks after she was born, I went back to work. A month, I was working 2 jobs, 11 p.m. to 7 in the morning, 9 a.m. to 5 p.m. I really didn't have much time to look in the news or see what was going on. It wasn't until January of 2016 that a volunteer came to my home, knocked on my door. We were looking at you like, who's the stranger? But we still welcomed them in. They explained to us what the water crisis was, which I really did not know. I can't put it down. They told me that there was lead, there was bacteria, that they had been covering it up. And it made so much sense to me of why my daughter was still not tracking lights, why she was still not looking at vision. There were so many problems with her that I couldn't really explain. I had gone to her doctor and say, hey, why is my daughter not looking at lights? Why is my daughter have so many rashes? Why is this? Why is that? But I didn't have any answers. When the volunteer came, I felt a lot of outrage, very, very, very sad. But I still wanted more, find a little bit more out. They were able to help me get a new faucet for my home, for my kitchen. So they switched it out, tried out the filter. But I want to know what my daughter's lead level was. At this time, somebody comes in, stranger tells you what's going on. You still want to know more further because the main thing for me is my children, my family. I went to her doctor. Her doctor said, no, we're not going to test her. She's not 6 months yet. Come back when she's 6 months. And I said, well, why not? Because it's not required till she's 6 months. Okay. So I went, I did my own research. I went to the UAW, other resources. The UAW at that time didn't have lead testing. They did give us some little tubes to test toys. They carried lead from China, but it was still not the answer they went. It wasn't until I went to the YMCA, kept losing a lot of time from work, but I wanted to know my daughter's lead levels if her doctor would test her. They gave me her results. I went back home, and I just felt terrible. I remember I was crying. My dad said, what's wrong? I said, I don't drink, I don't smoke, I don't do drugs. But the fact that my daughter has lead just kills me. I felt like I poisoned my own daughter, and I did. Because I was breastfeeding her, they explained to me that when you breastfeed someone, you give them the blood, whatever you carry on your body, which at that time I didn't know. They explained to me the water they had, that even with the filter, you still had to use bottled water, and I didn't know because I wasn't explained as thorough as I should have. A couple months afterwards, it was around April 2016, somebody came in, they said, hey, they need people to testify against the city of Flint. Will you do it? I said, most definitely. Gave them my story. They said, hey, well, we're giving out water bottles. I said, yes, you are, and I don't diminish that, but you are giving them throughout the times that regular working people cannot get them. From 9 to 5, it's impossible. I mean, think about it. It's just so time consuming. So they did extend it to us for that time. They gave us water filters. They started giving more food out, and it was very beneficial. However, everything has changed since then. It's still, I feel like not enough was being done. I left Flint, had to come back for July of 2017, this year. My daughter's levels had gone down tremendously because I did went to San Antonio, explain them to the situation, and they kept testing her. Came back, it was a 2.8, by September 3.5, November, December 4.3. And this time they're telling me, hey, the water has been fixed, there's no more lead. Which to me is a lie, because how did my daughter's lead level was increasing if I don't give her water bottles, and we only been back a couple months. I can't even imagine what her lead levels would be had it not left. This time they won't give us water plastic bags anymore. So now I'm gonna show you a little bit of my home. I really do feel as if this is my family. My son and my daughter, my father, and my newborn, he's only a month old. My house, may not be the best looking house, but it is my home. I own it, we bought it on eBay, and it really was a dream come true. I think all of us as Americans, owning your home without having to pay a mortgage or anything else, it just makes you happy. But if you can see my fence, it's completely full of water bottles. This is what we're supposed to do and don't do of Flint water right now. We just last month, we still had our boil our water. If you can see on the right corner, that one where the snow is at, my house looks like it has a lot of trash, but there's not. It's just tremendously amount of water bottles that I don't know what to do, and that I have to buy our own bags now. That's my fence because I just don't know exactly what else I could do. I only have three trash can bins to take out, but if I took off all my water bottles, they will fill it up. The corner on this side, they started fixing the pipes. That was in September of 2017. I was very excited. However, that's the only part they fixed, and the city of Flint has not put my pavement back yet. So anytime I do go out of my house, it is full. Well, if it's raining, I have put my putt. If it's snowy or it's icy, and I can fall down with my 2 children. I just found out they were supposed to fix all of it. I haven't heard anything from them. I must volunteer, so the city of Flint, this is where my daughter said, is one of the places I went to see if I could get her blood level tested. They were very educational. I still wasn't able to. And then the other one, it just says, it's just all children. It's a Hispanic Technology Center. We do a lot of different stuff, but we're not in a third world country. It is regular American people suffering every day with that issue. We do as much as we can, but it's not a way to live in. So this is my wonderful family. Now I'm gonna talk a little bit of my daily living. We all get up in the morning, you rush to wash your face. We don't, we rush to get a water bottle, open it up and wash our faces. Get another water bottle to wash our teeth, because you can't do it. I go through 3 cases of water just to bathe my 2 kids. My daughter was so excited last night when she got to take a shower or a bath because she had more water to play with. It is so difficult to lift off water bottles. It can't even explain to you. Being pregnant, trying to get cases. Yes, they put them in the car for you, but once you get home, you gotta get them out of the car, and you can't leave them there for a day because it will freeze in. It's a whole different issue. It's December 2017, trying to get up 2 cases of water, so with the toddler, it's very difficult. Hold on, I'm so sorry. As a parent, I don't want to live like this anymore. I don't want to stay here. It is very, very difficult. It's been 3 years since Flint has been in this water crisis, and it just seems tremendously long. I hope that soon we're able to resolve it. I do want to thank you for letting me be here, Ms. Amanda, and that's my story.
Thank you, Jacqueline, for being here today, and to your family also for making it possible for you to be here today, and for giving voice to affected families all over the country. We really appreciate it. Next, we're going to hear from Jean Schultz. Jean is an environmental and disease control specialist with the City of Milwaukee Department of Public Health. Ms. Schultz is the point of contact for all aspects of lead in drinking water at the department, including the coordination and distribution of point-of-use drinking water filters, as well as educational initiatives. So Jean, welcome.
Thank you for having me here today. I'm excited to talk to you about the work we have been doing in Milwaukee related to lead service lines. At the City of Milwaukee Health Department, we have been working to reduce childhood lead poisoning for more than 2 decades. The results have been significant. We have recorded a 90% decline of elevated blood lead levels at 10 micrograms per deciliter since 1997, and nearly 70% decline at levels of 5 micrograms per deciliter since 2003, and that's when we began tracking that data. Many of you who follow public health news may have heard over the past several weeks about a serious concern related to our program's follow-up on cases of elevated blood lead levels reported to us. I do not have an update on that issue today, as it is a different part of our program. However, I can assure you that we'll be issuing many reports in the coming weeks on this issue. But again, today I'd like to highlight for you the work we've been doing in our collaboration with Milwaukee Water Works. And I just want to start with a couple of basics about the City of Milwaukee. So in the city, we have about 76,000 lead service lines, plus about 5,000 properties where private side of the service line may be lead. Milwaukee started phasing out the use of lead for the public side of water service lines in 1947 and ended its use in 1951. Milwaukee enacted an ordinance in 1962 requiring copper service lines installation on the private side. Milwaukee has used orthophosphate for corrosion control since 1996. So in 2014, the Wisconsin Public Service Commission ordered an increased main replacement schedule. So this prompted Milwaukee Water Works to design a sampling project in 2015 to answer the following question: do main relays affect lead levels at the tap? So Milwaukee Water Works did come to the health department, and we also had meetings with the US EPA, the Wisconsin Department of Health Services, and the Wisconsin DNR to figure out a testing and outreach protocol on how to answer, do main relays affect lead levels at the tap? So they decided to do a sampling project, and that started in 2015. 21 single-family properties with lead service lines were invited to participate. 6 chose to participate, and regardless of participation, all properties with a lead service line received the same advisories, and regardless of the participation. So our testing protocol started with the participants collecting 12 consecutive 1-liter samples of tap water, plus a well-flushed sample on 3 occasions: before the project, after reconnection to the new main, and 4 weeks after construction. So the results showed us that there was definitely an increase in lead levels after reconnection of the lead service line to the new main. In most homes, the lead levels did lower 4 to 6 weeks after construction, and lead levels in all the well-flushed samples were below 5 micrograms per liter. So this led us to develop an approach on how to handle any disturbance to a lead service line. So those sampling results did lead us to believe that we needed to prioritize our approach when dealing with disturbance to the lead service line. Milwaukee Water Works did postpone any water main projects connected to lead service lines, and we developed outreach protocols for disturbance of lead service lines, and then that did expand to other different disturbances such as the city service leaks, main breaks, sewer work, and also just meter replacements as well. So we did have some recommendations at the time after our site sampling pilot went off. We did plan on discontinuing any partial lead service line replacements, because at the time, if we did have a lead service line break, they were only replacing that portion, either the public side or the private side. So now that they recommend doing a full replacement. We developed protocols for emergency leaks and repairs. They recommend adopting an ordinance mandating full lead service line replacement. Figure out a subsidy towards the replacement costs and special assessment financing that would act as an incentive for the homeowner to participate in the project. Develop a public information campaign, outreach to stakeholders, prioritize vulnerable populations, and seek legislative support for flexibility in the use of Milwaukee Water Works ratepayer funds. So this sampling project was released publicly. All homes that did participate in the testing received information about their test results and consultation from the health department regarding what did their test results mean. We did provide the sampling project updated to our Milwaukee officials and the media. So we did develop a citywide outreach plan based on this sampling project. Letters were mailed to 70,000 plus homes that may have a lead service line. We outreached to local healthcare providers about additional concerns about living in homes with lead service lines. We did outreach to licensed child care facilities, public and private schools that did have lead service lines. We presented this information at multiple community presentations and conducted media interviews. We also engaged local environmental and community advocacy groups, and we developed a Lead Safe Milwaukee public awareness campaign that not only talked about lead in water, but also all lead hazards, including paint and soil, and the importance of getting your child tested for lead. We did implement a vulnerable population strategy to reduce the risk from lead in drinking water from the disturbance of lead service lines. The first thing we did, we thought of a way of acquiring and purchasing point-of-use water filters to distribute to vulnerable populations that did live in homes with lead service lines. And we also identified licensed child care facilities with lead service lines as a priority for replacement. So originally we did send a letter to those facilities for testing to see if they wanted their testing, and we didn't actually get any responses from the licensed child care facilities. So we applied to the Wisconsin Department of Natural Resources, their Safe Drinking Water Loan Fund, to help fund the private side because we decided to move forward with full replacements at licensed child care facilities. So in December in 2016 was the kickoff for that program. We randomly chose 3 full facilities for a full replacement, kind of like a pilot, just to see what kind of issues and hiccups. And the whole time, Milwaukee Water Works and the health department working jointly on especially coordination, education, and arranging bottled water sampling and construction activities at these 3 pilots. So from there, once we figured out the hiccups and everything, we have now a more defined role on how moving forward with replacement at child care facilities. So how it works now, we did start by outreaching by telephone, and we realized that wasn't the best way to reach people just because a lot of our records don't have the most updated phone numbers for property owners. So we decided to send a letter to property owners about our free replacement program at licensed child care facilities. So we did have them call us then, and we were able to schedule site visits with the property owners and Milwaukee Water Works. We need to start with the property owners because we do need to have them grant access for us to the property to do the construction. After we had the go-ahead from the property owner, we then called the child care facility and offered them education and just general information on what to expect for the lead service line replacement. We then offered drinking water filters to the child care facility owners for their use until we could get to them for construction. And then we also provided information not just about drinking water lead hazards, but all lead hazards that could be found in their facility. So then from here, Milwaukee Water Works would then coordinate the paperwork for access, construction activities, and bottled water delivery. And then after about 2 weeks from replacement, the health department would then come in and we would sample their water to make sure that the levels went back to, from the construction would go back to low levels of lead. And then we'd also follow up with additional education about all lead hazards in their facility. So some of the challenges that we still have is that there still is interior plumbing that may still have lead pipes, fixtures, and solder after we do replacement. Not all child care facilities are licensed, so there's still multiple facilities that we're not going to be able to reach. And again, the non-responsiveness of some property owners to enroll in this program, it's been challenging just try to get them in touch with them about getting into the program. So pretty much our lessons learned from our collaboration so far is that collaboration between health and waterworks before events is obviously very helpful. Data-driven decision-making is definitely key because we were able to look at that sampling pilot to figure out what was going on with our lead levels after construction. Strong intergovernmental and regulatory relationships are important, and coordination with property owners for projects is challenging and time-consuming. So this is just a condensed version of how our collaboration started and what it is today. As always, open communication is key between the 2 programs. We would not be successful without it. Thank you.
Thank you, Jean. We'll turn our attention now to the story in Cincinnati, and we'll first hear from Cynthia McCarthy, a senior sanitarian with the Cincinnati Department of Health, who's a licensed risk assessor, a certified RRP trainer, and has been a public health inspector for 28 years. Cynthia will then turn it over to Kathy Bernardino-Bailey, who is executive director of the Greater Cincinnati Water Works. Ms. Bailey joins us today with over 25 years of experience, so pretty impressive set of years between the 2 of you, with the utility. And she started her career there as a chemist and moved through a variety of other functions with the utility before becoming director. So Cynthia, welcome.
Thank you. I'm Cynthia McCarthy from the Cincinnati Health Department from our Childhood Lead Poisoning Prevention Program, and I'm going to shorten that by calling it our CLIP program. A little bit of background about our program. We started our CLIP in 1974, which was actually 4 years before lead paint was banned from being used in residential housing. And our primary goal is to do public health lead investigations on children who are lead poisoned. In Cincinnati, we've had a steady decrease in the percentage of children who are lead poisoned who have been tested. We are at under 1%, hovering around 0.7. However, I wanted to show you, this is a map of Cincinnati and various neighborhoods, and the darker the color, the higher the percentage of children that are lead poisoned. In particular, I'm going to point, oh, that arrow didn't work. It's supposed to be pointing to Evanston. And in Evanston, we're finding incidences of children being lead poisoned at 16 and 20%. So that's 1 in 6, 1 in 5 children. So Cincinnati as a whole is doing very well, but in these pockets, we're seeing problems. And these dark red areas are overlaying low-income areas in the city, areas with depressed housing, what we call deferred maintenance, homes that have become deteriorated. So by state law, the way we start our public health lead investigations is to check for contaminated dust. So we're looking for that from deteriorated paint, from soil that's been contaminated from lead-based paint or from leaded gasoline back when we used that. And we test to see if it is lead. And the only way to tell is either through the X-ray fluorescence machine that tells us right away whether paint is lead or not. And then for the dust in the soil, we send samples to the lab and we find out in a day or two. We go in and we do a questionnaire with the family to see if there are other sources of lead. And we talked about what some of those other sources are, but we really didn't worry about the drinking water. Our story was that Cincinnati has some of the best drinking water in the country, maybe the best. Our story was that any pipes that might be lead have been protected by a layer of scale so that there wouldn't be lead in the water. We didn't look at it. We told families they could get their water tested at the waterworks for free if they wanted to, but we didn't push it. So then Flint happened, and we began our relationship in earnest with the Greater Cincinnati Waterworks. And at this point in time, we're having monthly teleconferences between our director, their executive director, and their lead and water personnel. So at this point, when our nurse case manager goes out to every single child with lead poisoning, she takes a water sample on site. She lets the water sit for 1 hour, which is about the length of time it takes to go through the questionnaire, and she takes a liter of water from the kitchen sink, labels it, brings it back, and once a week, Waterworks comes and collects those for us, and we get the results back in our office. I do want to point out that that's not an EPA protocol, but it's what we came up with as something feasible for screening their water. Additionally, any results that come back at the Cincinnati Waterworks that are greater than or equal to 15 parts per billion are sent to us at the health department, and we send a letter out to those families, to those households, letting them know what the health effects are for children, letting them know, telling them that they need to get their children tested because the only way to know is by a blood test for the children. We give them the location and the phone numbers of our clinics, our health department clinics, so they can come and get their children tested for free. And we give them information about our grant from HUD. We have a $3 million grant from HUD to create lead-safe housing for low-income families. However, the $3 million is earmarked for lead paint hazards. This grant cycle that started in 2014, we got an additional $400,000 in supplemental money to be used specifically for healthy homes issues. What we've been seeing generally for the healthy homes issues are trips and falls, leaking roofs, gutters, and structural issues, the porch columns or the porch floor. However, we can use this money for replacing lead service lines, but it must be used in conjunction with the lead hazard control work in the beginning. To qualify for the HUD funding, a family has to be low income. The occupants of the home have to be low income. So it's based on occupancy. I was going to tell you a little bit about our Hamilton County Lead and Healthy Homes Collaborative. This is an ongoing collaborative, longest running one in the state of Ohio. And it brings together a very diverse group of people, different agencies, educators, professionals. Well, I've got the list here. We meet every other month. And we have a speaker. We invite someone to come and speak. The last couple times have been folks from the EPA right there in Cincinnati. They've talked to us about their research, looking at the correlation between the amount of lead in the water and blood lead levels. And we just had a talk last week from one of their researchers who did a study on a vacant house and found that as it sat vacant for 2 years, the lead levels went way up. So there was discussion about what are we going to do when a vacant house is reoccupied, and someone asked, well, do you have other houses that you're going to test? And he said, well, I don't have access to that. So right here in our collaborative, there's another person who says, well, in my pocket right now, I have the key, the master key, to all the vacant houses owned by the city of Cincinnati. So right there in that meeting, we had this cross-pollination that happens almost every time. And we've just started our mini workshops, and these are, well, we're yet to have our first one, but what our plan is, half an hour at the end of our regular hour-and-a-half meeting. And this next one, we've invited our members to send in photographs of packaging of water filters. So point-of-use water filters and pitcher water filters. And then the folks from the EPA are going to help us decipher the language on the packaging, because apparently there's not any set kind of packaging yet. And hopefully that's going to spur them to determine what the packaging should say. We feel like this is a model for other cities to follow. Some examples of the people that attend. We've got our people, we've got inspectors and risk assessors, nurses, Greater Cincinnati Waterworks, their administrators and their lab personnel from their lead and water. They come in with their expertise. Dr. Newman from Cincinnati Children's Hospital, he's come to give us talks before, and he comes when he can get away. He's a specialist in childhood lead poisoning and asthma. Dr. J.C. Barnes has come from the University of Cincinnati, where he's doing an ongoing study on the correlation between adult criminal behavior and childhood lead poisoning. We've had the EPA guys come in, they're scientists, researchers, regional health departments, there's 3 or 4 health departments that send personnel, the Ohio State Department, Ohio State Health Department, and various neighborhood organizations, and we've targeted some Hispanic organizations to help with the language barrier. Other city departments, we've had building inspectors regularly come, rehab specialists, and their grant managers, they have had grant as well. Legal aid comes, we find that we have similar populations that we serve with the low-income families, and then the social service agencies make a regular appearance. We've got WIC, Head Start, the Hamilton County Jobs and Family Services Daycare Division, and Help Me Grow. And kind of a new partnership that we have is with ArtsWave. It's an arts organization, and they take shows into the schools for educational purposes through art. And I worked with the Cincinnati Art Academy for a semester with their art and social justice class, and they chose lead poisoning as their project. So for the whole semester, we discussed lead poisoning and various different outreach ideas, and they had a street fair at the end, and they did dance, they did puppet shows, they did models of different ways to get the word across, and it was absolutely fascinating. And we've had concerned citizens, parents of lead-poisoned children. So I just list all these to give you some ideas about who in your communities you might call on to come together. They're very casual and friendly meetings. We do a lot of targeted outreach. We send materials or we go out and speak to the PTOs. We have a very strong relationship with our real estate investment organization to talk to those homeowners about lead poisoning and possible sources of lead poisoning. Church groups, pediatricians, health fairs. We get out there just as much as we possibly can to help spread the word about lead poisoning prevention. Amanda talked about the costs down the road, and there was this study done in 2009 that I like to cite, that for every $1 we spend today, that's a $17 to $212 savings in the future. So it's very important for all of us to work together to end childhood lead poisoning. Thank you.
Thank you for having me here today. I'm going to speak about our program, as Cynthia mentioned, in the city of Cincinnati. First, I want to give you some general information about us as a utility and as a city. The utility serves about 1.1 million customers in the region. However, in the city of Cincinnati proper, it's about 298,000 residents across 52 neighborhoods. We know that 1 in every 4 residents are 18 years old or younger. Unfortunately, we have the second highest child poverty rate in the country in Cincinnati. Regarding lead service lines, we do still have some in our water system. we believe we have about 15,000 full lead service lines and about 27,000 additional on the private side, because there's a dual ownership in Cincinnati. We also know where these lines are across all 52 neighborhoods, but we know that they are in neighborhoods, in some cases, that have the majority people of color, as well as low-income residents in those neighborhoods. So there's certainly a social, economic situation with that, as well as concerns with affordability. So in Cincinnati, we have not had any violation of the lead and copper rule. We have been in compliance from day one with that rule. We take our test on a regular basis, twice a year, as outlined in the lead and copper rule. We report that data, et cetera. But from our perspective, moving forward, we just wanted to look at it from a proactive perspective and say, the time is now. We have had these lines in our system for many years. In the city of Cincinnati, we stopped putting lead service lines in the system in 1927. Since 1971, as part of the water utility, we have been removing them as we do our water line replacement program. So as we remove those water mains in the street, then we have been removing the lead service lines at the same time. But that's only a partial removal on the public side. When we had those conversations with the owners, they couldn't afford it, so that portion is still there, which is why we believe we have about 27,000 that exist in the city. So for us, we wanted to move forward with a program that proactively allowed us to remove the entire line. And so we had to find some ways to make it affordable for the homeowners to afford to take out their side as well. So we had a two-tier approach. Tier one is all about communications and education. There's some tools and services that we offer here. As examples that I've listed here, there's a few that I'll actually touch on, the ones that are in red as highlights from our tier one solution. Our website, here's a screenshot of our website. There's many tools here, a lot of information so our customers can come here, learn more about lead in drinking water. This is also where we have a link to our lead map. It's a lookup map where customers can actually pull the map up, type in an address, and then that address returns information on the screen that lets them know the material on the public side of the service line as well as on the private side. And so if it's lead on their side, they can start to make some choices on how they might be able to remove that line. This is a screenshot of our lead dashboard. This dashboard is used on a regular basis internally. It's a dashboard that's very helpful to many members of the lead team. When I look at this dashboard, I'm looking for two things, basically. How many kits are we shipping out for free testing per day? And that's actually the bar graph up at the top on the right. And then I'm also looking to see how many samples we've analyzed and what number of them are greater than 15 parts per billion. So if I look at this, I'm interested in knowing that number, because as we see when they're greater than 15 parts per billion, we have conversations with those homeowners. We want to know what's going on in the home. We want to get them some faucet filters, some pitcher kits, et cetera, in their home. And so I want to know that data. So as an example, on this screenshot from January 22nd, at that date, we had shipped 5,625 sample kits to customers. 3,598 of those had been returned. Of those, we had analyzed 3,579, and then 120 of those had values greater than 15 parts per billion. And that's when we had deeper conversations with those homeowners to figure out what's going on in the home and come up with solutions for them. A big part of our program is our assistance to schools. It was important for us to proactively reach out to the schools and let them know that we were available to them with free testing. And so to date, we've worked with over 120 schools. Some of them are completely through the process that we take them through. Others are in various steps along the way. But we use the EPA 3Ts guidelines to work with the schools for the free testing. We provide them with a lot of information, and then we also publish those results on our website to make it available to the school communities as well. This is where our partnership with the health departments came into place. Very helpful to have Cincinnati Health Department as well as the Hamilton County Public Health department available to work with us, to share information, to share data, so that we could know what we were dealing with within the schools and get additional assistance to our families. So our goal here was to understand the water quality in the early learning environments, certainly the schools, the child care facilities, et cetera, and then help those schools and residents implement solutions that further reduce the risk of lead. And so that's what we were after, and that was the big piece of why we wanted to put this program into place, and we spent a lot of time trying to figure out what it would look like. Our school program is 10 steps. It's not an easy program, but we think it's worthwhile, and certainly we've heard some great feedback from the schools. But briefly, it starts with us explaining our records to the school and the personnel in the school. If needed, we verify the actual service line that they have to see if it's actual lead. We provide them with a copy of the 3T's guidelines so that they understand the process that we're using. We actually have a school liaison in our utility where they actually walk through the schools with school personnel to identify the sample locations where we need to sample. Once we do that, we provide them with sample bottles. The school collects the samples for us, and then we analyze them. We're a certified lab in that way, so we actually analyze the free testing, and then we can do that for other utilities as well. If its results are greater than 15 parts per billion, then we have conversations with them right away to let them know the results, the locations, and talk about remediation plans so they can fix things quickly. We also have those conversations with the health department. What do they have regarding the families at that school? What do they know about the school, any testing, et cetera, so we can look at that data and see if there's any correlation. If needed, there's follow-up testing, which is why I said some schools are all the way through the process. Sometimes they have to go back, make some changes, and then we do follow-up testing with them again to make sure that we reduce those lead levels as much as we can. The big piece that the schools look for is a very detailed summary letter that we send to them that looks at all of their results and lets them know what they need to do per sample location, if anything, based on what we detected at each location. And then, as I mentioned, we post the results on our website. To give you an idea of the number of tests from 60 schools that I have listed here, there's been a total of 6,019 samples collected for those schools. And then you can just see the categories of the number of samples that we've seen in the breakdowns of those categories. We've seen some type of lead detection in every school, and we, in fact, have probably tested more locations than we actually had to for various reasons. And most of those reasons were teachers, personnel would tell us, no, we're not using this sink. But when we entered into a room, there was a coffee maker, a plate, 2 forks, a knife, et cetera, sitting next to some of these sinks. And we're like, no, you're using this. And so we sampled those locations. And so because of that, we had more samples than we initially expected to have per school. So funding, just to quickly tell you how we're doing this. I mentioned we give pitcher kits and faucet filters. Those have been part of our capital program as we have replaced water mains over the years. But for the free testing, again, we really thought this was the best thing to do for our community. So we figured out in our operating budget how we could do it. So starting in March of 2016, we believe we've spent about $43,000 for the residential testing, with about $12 per cost of each sample, and then about $72,000 for the schools and the analysis that we've done for them. But again, for us, we thought it was an important thing, so we looked at our operating budget and found out how we could have a substitution to make it happen. So as I begin to talk about Tier 2 for us, this is one of the reasons why Tier 2 is very important for us. The state of Ohio is the second highest state with the number of lead service lines. And so that's a huge concern for us. And then for us, we wanted to proactively address that in the city of Cincinnati. And so Tier 2 for us is all about removing the complete lead service line. And so we sat around the table, a very large lead team in-house, and we decided different proposals and then moved forward to our city council members, and they approved us for the program that's shown here. Last June, they approved this program. It's a 15-year program for us to remove all the remaining lead service lines in our system. And so what we will do, we will pay for the removal of the entire line up front. And then if the customers come into our program, we will give them $1,500 towards the removal of the private side. And so then that reduces their balance that they then owe us and can pay back to us over 5 or 10 years through a property assessment that stays on the property. If they move, it stays with the property. And so that program was approved for us by our council members, and that's what we've been moving forward with. We spent many months trying to figure out how to operationalize that and just started sending letters out to customers December 22nd. And as of yesterday, we had about 30 people. We've only sent about 200 letters, but 30 people that have entered into the program, which for us is a good start, and we think we're ready to go with this program. So overall, we realized early on this is the right thing to do for our community. Other communities might be looking at this from a different perspective, but we wanted to look at it and say the time is now for us to remove these lines. We know they're there. As long as they're there, there's a continued risk that something can happen. So we wanted to look at a program that would allow us to remove these pipes over the next 15 years. But we realized also we could not do it alone. And so with that, our first partnership was with the health departments, and that has certainly been a great partnership and the way for us to move forward, because we're doing this from a public health and safety perspective, and so that initial partnership was definitely with the health department. So thank you for allowing me to share information.
Thank you both so much for sharing that inspiring model of collaboration. I'm guessing our audience here and online is likely brimming with questions for you and our other panelists. So now we'll move into the question and answer portion of the event. I'm going to also ask Tom Neltner, who's Chemicals Policy Director from the Environmental Defense Fund, to come join the panelists also as a representative of the Lead Service Line Collaborative. So welcome, Tom. We'll remove your name tag here. So for those of you in the room, we're going to ask you to come up to one of the 2 mics we've placed in the room to ask your questions or share your comments. But we also hope that those of you who are watching online will join us. And the way that you can participate in the conversation is you can tweet your questions or comments to @GWSPH online, and make sure that you use the hashtag #SafeWater. Those instructions should be on your screen, and we look forward to getting your questions. And to give you guys a few minutes to start lining up, I see we've got some folks already joining us or submitting your questions online. I'm going to start with one question that we received in advance of today's event. And you know, this event, in the title, it talks about partnering to protect public health, and I think that's with good reason. And a lot of folks today may be wondering just how exactly do you do that? So I wonder from our panelists, particularly Jean and Kathy and Cynthia, if you can share with us, for folks out there who might be wondering how to get started in their community, what advice do you have for a water utility who might be interested in reaching out to a public health department, or a public health department reaching out to a water utility? Does it matter who starts the conversation? How do you get that going?
I think for us, as the water utility and being the expert in the city, we started that whole process to reach out to other entities. And so for us, we wanted to sit down initially in-house, figure out what we were trying to do. And then once we knew that, then we started to reach out to other entities, with the health department being first. But I think water utilities have a big stake in this to lead the effort, and so I think it would be helpful if water utilities can reach out first.
And I think it's just good to know that both of you, when you do have that conversation, is to be open and understand of each other's processes. So the water utility is different than the health department on how we handle outreach, and just so that everybody's open and acknowledges that we all are on the same page and we're trying to focus on one solution, and that is reducing either lead in drinking water or any other issue that they're discussing.
Any other comments from the panel? Great. Well, we'll turn and have our first question from the audience.
Hi, I'm Jerry Paulson. I want to compliment Cincinnati for its plan to get rid of lead service lines and for taking care of sort of both sides of the line, because taking care of only part makes no sense. But I also wanted to ask about until you get rid of all the lead service lines, the use of the number 15 for identifying water that is problematic. That number I know comes from the lead and copper rule on the one hand, but on the other hand, that is not a health-based standard, and there's no guarantee that people exposed, and particularly children exposed to concentrations of lead below that number in water will not be harmed. And so is that really the appropriate thing to do until such time as you can replace all of the lead service lines?
So definitely a great question. That is the basis of that detailed summary letter that we started with the schools. When we send a school a letter, if there's any lead detections, we speak to that. So we look at, is it a drinking fountain? Is it a sink? Is it a cooking outlet, et cetera? And we give them things to do even below 15, because we say clearly in our letter, we want to reduce the risk of lead everywhere. And so we want it to be below the detection level. So if there's any type of lead detection, we speak to that and tell them what they need to do. Sometimes we tell them, you need to put up signs in the rooms, in a science room, and say, no drinking water, or this is just science experiments only. It's things like that. Other times we tell them, tag it out of service. You don't need to have this in service until you can come up with a remediation plan on how you can greatly reduce this. So there's a number of things, but it's one of the reasons why the schools look at that, because we're speaking to any detection of lead.
Thank you. Another question?
Yes, thank you for the forum. My name is Paul Schultz, and I'm with an organization called the Campaign for Lead-Free Water. We operate in about 25 cities around the country with frontline communities, including in Flint. And I want to thank Senora Jacqueline Vargas for her testimony. It was the only truth that I heard on the panel today. And I want to confront the situation that we're in here at the Milwaukee Institute School of Public Health here in Washington, D.C., where we lost, according to national award-winning peer-reviewed studies, 200 children to fetal death, 2,000 unborn babies, and up to 42,000 children who got elevated levels of lead from a cover-up that extended over 2.5 years from 2001 to 2004. And that was followed by 2 studies, one from T. Guadati of this institute that lied and said that there was no health harm from lead in water. And this institute refused to investigate that study. And by the CDC and our Department of Health that did a study that was made up about a whole cloth that showed that there was no relationship between any amount of lead coming out of the water in our taps and public health harm. For the last 13 years, coming out of the ENGO community, I have dedicated myself to this work. And over the last 22 months, have worked with Freshwater for Life Action Coalition in Milwaukee, Women for a Healthy Environment in Pittsburgh, and groups like that in many cities in the front lines. Up against water utilities, public health departments at the local level, state health departments, medical officials who have pushed back along with the water authorities. At every level, the only things that have gone and happened positively out of communities have happened because of community pressure from the front lines. And right now, what we're facing is the Lead Service Line Replacement Collaborative coming out of the work group of the National Drinking Water Advisory Council to US EPA is replicating the harm and putting forward a narrative that if we do voluntary full lead service line replacement, we support full service line replacement, but not voluntary, regulatory. They won't talk to the ban on partial pipe replacement and make that part of the policy conversation. They stood up, the same people who are at the heart of the lead service line replacement, including Tom Neltner from Environmental Defense Fund and Ensay Witherspoon from Children's Environmental Health Network, which is a co-sponsor, with the water utilities, pushing the water utility package, which takes liability away from the water utilities, accountability away from the water utilities, transparency away from the water utilities, and pushes the solutions away from collective solutions towards household action levels and towards individual water tests. They're going to take an already, as we've heard from Lynn Goldman and others, an already weak lead and copper rule at the federal level and try to weaken it further. If US EPA, Office of Groundwater and Drinking Water, and others follow the recommendations of the work group from the National Drinking Water Advisory Council on the revisions to the lead and copper rule, we will see more, not less harm in our communities. I'm here to challenge the ethical and moral compass of the water utilities in this room, of the health departments across the country who have ignored and manufactured and created manufactured ignorance in our country about the lead and water issue. What wake-up call did we need from Flint when we had 20 to 30 times the amount of lead flowing through the taps of Washington, D.C. from 2001 to 2004, which was exposed in over 100 articles in the Washington Post in 2004, 2005, not only D.C., but across the country. The Healthy Homes community, your community, the Healthy Schools community ignored the science and still ignore the science on lead and water to the detriment of public health. Where are the conversations with the frontline communities at the center of the lead service line replacement collaborative? We are iced out. Our narrative is stolen. There's a misdirection, a silencing, a public belittling, an erasing of our narrative to be elided, to be moved in a new direction. This is my question. When is this going to change? When are you going to include the people who are being directly affected at a policy level and an implementation level, and not just put us off to the margins? When are you going to stop saying that we should be doing voluntary replacement and we should be putting this into our capital budgets for full replacement? When are you going to be saying that's not sufficient because the corrosive chemistry of the water in our homes and other buildings are leaching out lead even in homes that test below 15 parts per billion, because we have a variable and erratic release of lead from lead particles that mean that 10 homes that test zero or non-detect today, in an hour or tomorrow or next week, could be in the hundreds or thousands of parts per billion. Why are we basing our school remediation programs in Cincinnati or in other cities like Pittsburgh
Schwartz,
or other places in this? We
would
have no voice, and you're going to silence me
I'm
again?
not going to silence you. I just want to reflect that I want to thank you for your candor, for your passion, for your advocacy. I believe you're putting an important question on the table here, including the questioning of how can we partner responsibly with industry, and how that has been at the heart of the lead service line replacement collaborative. And so in the spirit
The heart of the lead service line replacement collaborative is to create an okey-doke.
To invite a response from some of the members of the panel so that we can begin the exchange that you have called for. So thank you again for your candor. Everyone in this room shares your passion and goal of protecting
Peer-reviewed literature and corrosion control experts at the Office of Water, ORD, Office of Research and Development in Cincinnati, support the position that I'm putting forward. This is not a controversy in the science. What we have is a controversy in the politics that's going on this panel and in the institutions that are represented in this room.
Again, thank you for your candor and your perspective.
So I'll go ahead and try to, you mentioned Tom Nelder, you mentioned me, and I did serve on the Lead and Copper Rule Working Group, Paul, and you regularly attended those meetings. I can also tell you that 20 years ago when I started working on lead in Indiana, I thought paint was the only source. It wasn't until I served on that working group, and Paul, you were an alternate on that, I learned about water as a significant source. And I think that's changed a lot of my views. I also learned that the reason you didn't get your child tested at 3 months and you got that response was because we assume it's all from paint, so we don't test the child until they're crawling on the floor, which isn't right. So you make some really good points. I can tell you from the collaborator's perspective, although what I would say is it's going to take, we have to get the lead and copper rule fixed. The lead and copper rule needs to be overhauled. It has to be fixed. Since Flint, we've learned a lot of lessons that can adjust how we do that. Since we had a great dissent on the lead and copper rule working group, that also helped reveal some of the shortcomings and the directions that we can go. We have to get that rule fixed. But at best, if you get that rule fixed, it'll be 5 years till you get it in. What do we do until then? For everyone. Well, we have to get communities doing more on lead. That's why the collaborative, to get all 25 groups together, is focusing on those voluntary steps until that lead and copper rule working group, or until that lead and copper rule gets fixed. That's why we can see and applaud the efforts like Cincinnati to move further. Could we do more? Well, to get yes, absolutely. We have to get those lead service lines out. But the best place is let's get it done and let's help those communities across the country start that process and pressure EPA and the states to do their job.
Thank you. And thank you again for bringing forward. The challenging questions are a necessary part of solving this problem. So I thank you for bringing that forward. I want to, before we get to you, I just want to check in to see if we have any questions that have come from online, from our online community.
Thank you. Sorry, from this media center over here. Someone from online said, in Maryland and D.C., water utilities claim that there are very few lead service lines left. What can be done for people who rent and live in older structures with lead plumbing? Low-income areas have very few advocates in their landlords.
Another panel.
So the renter certainly is a challenge because often, particularly in Cincinnati, we see the renters, they are actually the ones who want their water tested, not so much the landlord. So then they get these results, and so we send the results to the actual person who requested it as well as the property owner. But often there's that connection, the renter, the landlord, where the landlord might not want to do anything. And so there's definitely some challenges. We have not figured all of that out yet, but we're certainly recognizing that there is a bigger issue there and trying to figure it out. We have recently had some landlords come forward and who want to participate in our program to get their lines out. So we see some, but we know that we won't see all, and we need to figure out how to address that. But it is a challenge with the renters because they're the ones who want the lead service lines removed. Landlords might not want to do that or might not want to do it in the same time frame when the renters want it done. So it is a challenge, bigger challenge than some of the other issues we have.
And Cincinnati did require that you landlord property owners disclose the presence of a lead service line to potential prospective home buyers or tenants, and that's a big step forward. Part of the challenge is in Maryland, for example, we don't know where the lead service lines are, and the utilities that say we don't have them may only be talking about the portion that's on public property, not the portion that's on private property, so we don't get the full story. And for a utility to say, it's not ours, it's not our responsibility just because we pulled out the part that we feel we own, is telling only half the story. It's misleading.
Hi, Sarah Vogel from EDF. Thank you again. It was a great panel. A bit of a sort of a follow-up question from Ms. Bailey. Do you have an assessment of how many, I can't remember that number of the properties that you're going to be reaching out to, how many do you think might actually be able to get covered by that $1,500 estimate? And I'm just curious where that $1,500 estimate kind of came from, without going too deep in your weeds. Mm-hmm. And then just on the kind of tenant issue, if you could share with us a little bit about how you're thinking about that outreach engagement, if there's sort of like a prioritization process where you're targeting, how you're thinking about, those the property owners versus, and how that's getting to the renters, just kind of teasing that out a little bit because it's a really exciting program. Thank you.
Sure. So 2016, we sent letters to every property owner. It was actually 25,000 or so letters that we sent to every property owner where our records indicated that there was a lead service line. And it was actually more than that because we sent them to the property owners as well as the renters in that area. That was our first way of notifying them that they had from our records, a lead service line. We asked them to call us. We want more information from you. We want to know if you've changed anything out, all of that. We heard from very few people regarding that letter. We tried to do some additional things, social media. We then started going out to the neighborhood meetings on a monthly basis to find people there, to just start having the conversation, to let them know what we're doing. Because again, we were trying to prime them to give them information, knowing that we were in-house trying to work on a program to move us forward and remove the lines. So at the point when we got to trying to figure out the process and the program, we went back and forth, you know, the whole partials and fulls, and we had been doing partials for years, but we're like, partials aren't what we need to do. We need to get the entire line out. And so that's when we said, we got to figure out a way to make it affordable. And so we sat around, ran some numbers, talked to the budget people in the city, finance, et cetera, and talked to our lawyers to see if we could even do that as far as the grant of $1,500 per person. But everything came back and said that we could. And so I don't remember all the criteria or the numbers that got us there, but $1,500 is offered to everyone. It's not just low income or seniors or anything of that. If they come into that in our program with us, where they're partnering with us to do it, then $1,500 is offered to them. And so they can get the $1,500. In addition to that, we know that $1,500 still might not be enough for people. So we established a customer assistance program. And so now we're trying to find funding for that. We're using things like our cell tower revenue, where we have cell towers on top of some of our tanks. We use that money for that. We have an employee program where employees can put into a fund that will help. You know, so there's a number of things. We're actually trying to figure out grants we can apply for. We plan to hit up the large companies in our city, you know, as much as they want to give back to the community. Hey, we're the community too. Put some money in this fund that we can help. So we're trying to figure out, again, different ways to make the program successful, but we're not interested in partials. We're way beyond that. You know, the full removal is what we're trying to do.
Kathy, a quick clarification. It's not actually a grant of $1,500, it's a sharing where they have to put some money in. It's not, so it's, I think, 40% or 50%.
So if it say, as an example, $4,000 for somebody to remove their lead service line, we will provide $1,500 to them. The balance is $2,500. So then at that point, they can apply to our customer assistance program, and maybe they get $500 additional out of that. So then their balance is $2,000 that they then can pay back over either for 5 or 10 years through a property assessment that occurs every year on their property.
Wonderful. Thank you so much. We look like we are actually at our time. I see there are more questions coming in via Twitter, and we will work together as a consortium of the partners organizing this event to see if that we can respond to those questions and get those answers out to you. In the meantime, I want to thank all of our panelists, the strong consortium of partners that organize this event, our hosts at GW, and all of you for a lively and thoughtful and challenging but important discussion today. To help keep that conversation going in your communities, we will be following up with links and resources mentioned today, as well as some of the answers to the questions and comments we didn't get to during today. And as I said, as your conversations and actions evolve in your community, we'd also love to hear how you're taking action to protect residents in your community. Thank you again.